I'm Lisa Pickering, and welcome to CITV's Press Talk. Here's the most recent news and information from the government of Bermuda.
Good morning, everyone. I am Scott Pearman, Chief Operating Officer for the King Edward VII Memorial Hospital and the Mid-Atlantic Wellness Institute. I am very pleased to welcome you here today, the first day of Mental Health Awareness Week for 2017. I would first like to recognize our Minister of Health, the Honorable Kim Wilson, JP MP, the Junior Minister of Disability Affairs, the Honorable Tanae Furbett, JP MP, the Permanent Secretary of Health, Jennifer Trid Sterling, along with our Acting Chair of the Bermuda Hospitals Board, Ms. Lucille Parker, our Chief Executive Officer, Mrs. Vanetta Simons, our Chief of Psychiatry, Dr. Chantal Simmons, our Deputy Chief of Psychiatry, Dr. Anna Nielsen-Williams, our VP of Quality and Risk, Mr. Preston Swan, and the Clinical Supervisor, Allied Health of MWI, Ms. Morrisa Rogers. Mental Health Awareness Week is organized by a hard-working committee at the Mid-Atlantic Wellness Institute. We are here today in Bermuda Hospitals Board's Carrick House Staff Wellness Center because we will be focusing on the importance of good mental health in the workplace. At BHB, this location is the center for both the mental and physical wellness of our staff. Whether it's trying to maintain our health through staying active and informed or trying to manage it when we are mentally or physically unwell, this location is where many of our staff turn as its first source of help. I'm therefore very pleased to be able to welcome the Minister here to officially launch the week for Bermuda.
Good morning. Is it afternoon? Is it afternoon yet? Good morning, everyone. I'm truly pleased to be here today to launch Mental Health Awareness Week 2017. I'm personally very passionate about mental health and raising awareness, so this is an initiative that I'm very proud to be a sponsor for. This year, the focus is on mental health in the workplace, which is highly relevant in our community. We think of mental illness as a private issue. In fact, I think many of us would shy away from talking about our emotions and our mental well-being at work for fear of discrimination or being seen as weak, make mental illness a very silent menace. And yet globally, mental health issues cause more absenteeism than any other illness. Mental health issues also cause presenteeism, which is when you spend more time at work than is required, oftentimes going into work when you may not be feeling well simply because you feel that you do not have the job security that you desire. 300 million people suffer from depression, many of whom also suffer from anxiety symptoms. A recent study led by the World Health Organization estimated that the cost of depression and anxiety disorders alone cost the global economy $1 trillion each year in lost productivity. In the United Kingdom, some 70 million workdays are lost each year due to poor mental health, and 6 out of 10 people say poor mental health impacts their concentration at work. Not only do we feel better with good mental health, but our employers benefit from improved productivity. So we know this. Why is mental health a bigger conversation in our community and our businesses? There's a stigma people feel with mental health illnesses. It speaks deeply to us about our fears of not being strong or not being able to cope. Mental health problems must be considered to be just as important as physical health problems because at the end of the day, it is an illness just like any other illness. It is frequently curable and always manageable, but it has to be acknowledged first so that you can get the help and the support that you need. I'm here today to encourage businesses to do their part in making the mental health and wellness of their staff a priority. Oftentimes, businesses have a litany of initiatives to raise awareness with staff, stressing the importance of health and safety, such as working things insofar as helping people understand where's the fire exit if there's going to be a fire, or you see flyers around saying wash your hands for 30 seconds, et cetera, et cetera. Health and safety issues, you always see that businesses have those type of strategies and initiatives, but it's equally as important for businesses to develop initiatives designed to raise awareness of the importance of mental health in the workplace. So what can businesses do to support mental awareness in their environments? It's not at all very complicated, and it's frequently is good common sense practice. First of all, what helps us to stay mentally well? Well, we're standing here in the gym of BHB's Care House Gym, staff gym, and having a wellness program and encouraging your employees to be physically active is hugely beneficial to reducing stress. Having policies on work-life balance and preventing harassment and bullying also helps to support your staff so that they become or feel that they have a trusted and resilient teams within the employers within their employment. Recognizing staff and demonstrating their value also gives people purpose and meaning and generally drives up productivity. Involving staff in decision-making conveys a feeling of control and participation that improves mental health in everyone, and it also encourages support for necessary changes and improvements. Offering career path and development can also keep people positive and motivated within their employment. But not all mental illnesses is preventable. So having a process to identify and refer staff members who may be struggling or finding it hard to cope and promoting to staff where help is available ensures that mental health issues are identified and treated early. Having policies and practices that identify distress, harassment, and substance abuse all help to provide early interventions and treatments. Better for individuals, it's better for companies. In essence, all the pieces that make up a positive, supportive work environment also make a mental health friendly workplace. There's more that can be done specifically for mental health. Finding opportunities to make mental health and the support available. A workplace conversation stops people from feeling isolated when they are suffering and more likely to seek help. Raising awareness of mental health can serve to reduce the misconceptions. When we increase the awareness of mental health, we also increase the chances of early intervention, which also leads to faster recovery. The Mid-Atlantic Wellness Institute offers mental health first aid training, and having one or more first aid responders in mental health in your workplace could assist an employee in moments of crisis. Such training also gives the businesses more confidence to hire people with a history of mental illness. Helping them on the road to recovery is important and critical. Although mental health is covered in the Human Rights Acts of many, many countries, it is still recognized globally that mental health has the greatest discrimination associated for people that are looking for and seeking to remain in employment. And it's a vicious circle and a vicious cycle, as unemployment can exacerbate mental illness. So to employers, I ask for more thought and positive intent in the workplace environment and culture that you are building. To employees, I would encourage you to be thoughtful and supportive to your team members and your colleagues. What we each do and say each day can make a difference to someone in our lives, and our contribution to a positive workplace can prevent mental illness in some instances and support the recovery of people suffering in others. Finally, to support the care of all those in our community and inpatient mental health programs, I am very happy to inform you that the Bermuda Hospital Board has launched a new scholarship. It has been made possible by the kind donation of the Bermuda Hospital's Charitable Trust. Two $40,000 per year scholarships are being offered to nursing students who complete the 2-year course at the Bermuda College and then go on to specialize in mental health nursing. An agreement has also been entered into with the University of Nottingham, so student places as well as funding are now available. This is truly an amazing opportunity, and I commend the Bermuda Hospitals Board and the Charitable Trust for making this happen. Our community is desperate for people to move into mental health nursing, so I'm very happy to see investment in the critical nursing specialty. More Bermudian nurses in this area will help ensure a stable service in the long term. Not only do we want our workplace to support good mental health, but need to have the services for those who do suffer from a mental illness to be appropriately staffed by qualified individuals. The Ministry of Health also awards the Barbara Ball Scholarship to students who are pursuing healthcare degrees, and I'm happy to say that one of the 10 new recipients, Ms. Chantel Painter, is pursuing mental health counseling. Lastly, I am also very aware of the challenges with our Mental Health Act, and I'm pleased to report that the Bermuda Hospitals Board, and the ministry have been reviewing the act, and we expect to have a consultation paper ready early next year, 2018. Raising awareness on mental health and the contributors to mental illness is an issue that I am very passionate about, and I hope that the business community will embrace this year's topic wholeheartedly to bring employees better mental health in the workplace. So with that, I declare the official launch of the Mental Health Awareness Week. Thank you.
Honorable Minister, thank you so much for taking the time to come today. And I would also like to take this time to thank Tanae Farbett, our Honorable Minister, Junior Minister of Disability, for taking the time to come as well. Protocol having been established, I would like to take this time to thank the Mental Health Awareness Week Committee, who have truly worked as a team to ensure that the activities planned during this week would meet the objectives. One, to ensure that we notify those in the community as well as our colleagues here within BHB. I would also like to recognize our community partners this year. The Bermuda Mental Health Foundation, who are offering an online training tomorrow, October 10th. And you will see other information regarding their online trainings at various times on our BHB information website as well as Facebook. We would also like to mention the Human Rights Commission, another one of our community partners today. They will not only be taking part in our amazing chase, all 6 members of the team, but they will also be assisting us with a radio show on Sherry J, Thursday, October 19th at 11:15. They will talk to us more about what can be expected about mental health in the workplace. We would also like to let you know about our community CME offering. That is our continuing education event that will be on Wednesday, 12:30 at our social center at MWI. Dr. David Wolf, Vice Chair of Psychiatry at Brigham and Women's, will be joining us to talk to us a bit more about the importance of mental health in the workplace. So at this time, I would like to thank you all for joining us today. Thank you for taking the times away from your schedule. And please be sure to let others know about mental health in the workplace during this week. Have a great day.
You've been watching Press Talk right here on CITV. Join us next time for your government's news and information. I'm Lisa Pickering.